You're live. Hi, everyone. Welcome to today's webinar. We will be discussing common skin infections in children. I'm Karen, your host for today, and we are honored to have Dr. Mimi Wong, a highly respected pediatric dermatologist at Gleneagles Hospital Kuala Lumpur. Hi, doctor. How are you?
Hello, Karen. How are you? I'm good.
Good. Thank you for being here and thank you for taking the time to talk to us about a very important topic. We have many people in the audience actually that are waiting to hear from you, and they have several questions ready for you. We will open the floor to everyone in the audience. We will open the floor to questions from the audience at the end of the presentation. So stay tuned. We may
Okay.
leave You may leave your questions in the chat below. So before we start, Doctor, would you like to share more about your role at Gleneagles Hospital Kuala Lumpur?
Yeah, thank you very much, Karen. I'm excited to be here. Let me introduce myself. I'm Dr. Mimi Wong. I'm the pediatric dermatologist. A lot of people don't understand what is a pediatric dermatologist. Even doctors also come and ask me, hey, what do you do? What are the cases that you see? So just let me highlight that we are pediatricians who have special training in managing cases or children who have skin-related problems, right? From the time they are born, which means like during baby time, newborn, up to the age of 18. Yeah, so 18 years. So we actually manage, small baby up to children age and also up to teenagers. So why I want to highlight that is skin related problem, just not skin only, because, we also handle cases or children who have hair problems and also nail problem. Why actually we also have training in this hair related, skin related, and also nail related problems is because, in the womb of the mother, when the baby is being formed, these hair, nail, and teeth, as also skin, are originated from the one place, what we call ectoderm. Right, so it's not uncommon that when you have one of these components affected, then you have another problems as well that's from the same origin. So that's why we are all trained to actually manage all these, hair related problems, skin related, and also like nail related problems. Yeah, so that's how we actually, that's what we do actually. So there are also very few of us in this Malaysia, the whole Malaysia. Basically, there are about 14, 15 of us. Yeah, so at the number 10, right?
Wow.
So we are a rare species, but the thing
Very
is that we do realize the need of, like, raise the awareness of the public about how common are skin problems among children, because
Mhm.
the skin problem among children is just not skin deep. It can have a lot impact to the children's and also caretaker life as well, right? So today, I'm very excited, super excited to talk about something that I am very passionate about, which is the common skin infections among children, because this is my bread and butter of my, my practice, and I see this almost like every day in my practice as well. Okay, so let's start with this webinar.
Yes. So I will leave the floor to you, and without further ado, let's have the webinar start.
Thank you, Karin. Okay, so these are let's start with the objectives of my talk today. Okay, so I would like to discuss about the various functions of our skin, and also I would like to review the common skin infections among children via case illustration. So I feel that the best way to learn about skin condition is to look at the cases and then learn from each of the case, because they are each very unique. And also I would like to discuss the management of these infections briefly. Okay, so I always ask this question to my patient or even my doctor, friend. So what is the largest organ in our body? Take 3 seconds to think about it. So what do you think? Is it because of the lungs? Is it the largest organ? Is it the lungs? Or is it the guts or our intestine? Or is it our liver? Or is it the skin? So what do you think is the largest organ in our body? And the answer is in the next slide. Yes, if you actually answer skin, congratulations. Skin indeed is the largest organ in our body. Being the largest organ in our body, we definitely have to highlight the functions of our skin, which is going to show in the next slide. Yeah, so what are the main functions of our skin? So basically, there are 7 main functions. So let's start with number 1, which is the protection. Skin actually gives us the protection from, protect us from dehydration, all sort of infections, injury or trauma, as well as the sun damage, right? So number 2, very important function of our skin to provide us sensation, right? So our skin allow us to recognize pain so that we can actually move away from the danger. And also it allows us to feel the touch of our loved ones and also the pressure. And also it allows us to feel the hot and cold so that we can actually, when we are feeling cold, then we can actually wear more clothing to protect ourselves. The number 3 very important function of our skin is to regulate our body temperature. This can be done by release and preserve heat via sweating mechanism. So another thing is very important, our skin is, it actually is the first line defense or actually first line of immunity to our body. So not only that, it also interacts with the immune system of the body to help disrupt whatever, microbes or germs that want to invade into our body, right? So this is amazing defense mechanism there in our skin. Furthermore, our skin also actually allow us to move and to grow. This is because it has a great elasticity and also a very good recoil properties on all the layers of the skin, meaning that it can help us adapt for growth and also movement. So number 6, the important function of skin is to help us to remove all the unwanted things from our body, so such as ammonia, uric acid, urea, and also excessive water while sweating. The very last but very important function of our skin is to produce vitamin D, which is very important in our growth and also our bone health. So this is very important. As you see that being the largest organ, it carries a lot of functions, important functions in our daily living. Now, I want to highlight that most of the children will have one skin infection at some point of time in life. However, who are actually at higher risk of getting skin infections? So this group of children who are at risk of skin infections include those who have eczema. This is because they are born with this skin barrier defect. So that's as a result that it allow easily invasion from the germs from the surface of the skin. And those who are immunocompromised, that those cannot fight infection, and those who live in overcrowding area, and also those who actually tend to share personal belongings are also at risk of getting skin infections. So how do we categorize skin infections in children? We can categorize them according to different types of organisms such as virus, bacteria, fungal, and parasitics. A lot of people still don't understand what are the difference between these. So I'm going to show you in the next slide. So these are very simplified tables to differentiate the differences between virus, bacteria, fungus, and also parasites. So viruses are very, very small, non-living particle, right? They depend on the living host. So they have to actually live on other hosts in order to cause problem to the skin, also to the body. They are extremely small, just like bacteria and virus, both actually cannot be seen using by our naked eyes. So for the virus, usually most of the time we don't have any specific treatment except certain ones. For instance, like influenza, you have this oseltamivir, you have herpes infection or chickenpox, and you can actually use certain antiviral like acyclovir to treat. So examples of virus are HIV, human immunodeficiency virus, herpes simplex virus, dengue virus, even our COVID-19 also is a virus infection. As compared to bacteria is slightly larger, but still cannot be seen via our naked eye. And the treatment is actually antibiotics, right? We don't use antibiotics to treat virus problem, viral infection, but we use it for bacterial infection. So the examples of bacteria are Staphylococcus pneumoniae, which is very common in children, causing pneumonia, and Staphylococcus aureus causing skin infection, and E. coli causing diarrhea. What about fungus and parasite? They are actually big things, big organism that you can actually see, right? You're using naked eyes. So very straightforward. Fungus, you use antifungal, right? The examples are dermatophytes and candida, whereas parasites, you use antiparasitic agents. The examples of parasites includes mites, fleas, and also ticks. Let's quickly start with the common virus skin infections. So As I mentioned, we'll go through some cases because that's the best way to learn. So this case number 1, this boy, 4-year-old boy, presented with multiple white color bumps on his face, as you can see here, which gradually spread to the tummy for 6 months of duration. Mother is very concerned because it's getting more. It's like the child started to be bothered. The child started to scratch over the skin with the time. And you can actually have a close-up look on the uppermost picture here. There's a close-up look of each individual of the lesion. You can see that there's very like a small, like a central depression in it. So what do you think is the most likely diagnosis here? The most likely diagnosis is molluscum contagiosum. This is a very common kind of virus infection that we see in the skin of the children. So they usually present with localized cluster of these little bumps with this central depression. This is a classical description of this kind of virus skin infection. So it's caused by pox virus. And in Malay, this molluscum contagiosum is actually called ketuat nasi or ketuat lembut. Okay, so how did it get transmitted? This is actually transmitted via direct skin-to-skin contact, okay, or indirectly via shared towels or shared clothing, and also auto-inoculation. So what is auto-inoculation means? It means that you already have one, the virus infection over the skin, right, with the hand, the fingers. Then you're going to scratch it on other parts of the body. As a result of that, you transmit this virus to another part of the body, causing this, spread of the lesion. That's what we call auto-inoculation. So how do we treat this? A lot of time you don't really need specific treatment because most of the time our immune system will attack it and actually tackle it. However, the problem is each of these lesions, I need to let you know that it can last from 12 months to 18 months. So when you scratch to another part of the body and then the second lesion develop, that second lesion will actually last, 12 to 18 months again. So during these 12 to 18 months, if the child scratch again and then cause more widespread of this lesion, then it could be very distressing to the child. Then I would actually usually treat. So my take is that if it's like multiple, involve two parts of the body, I would actually start treatment. You can use physical destructive methods or medical treatment. I usually first time we start with the cream first, which is medical treatment. You can use antiseptics, povidone or hydrogen peroxide cream, and also keratolytic agents such as salicylic acid, which is quite common to be used in a pediatric dermatology setup. And also we can use physical treatment such as cryotherapy. So this is a video that I actually want to show you what is the cryotherapy. So we have this cryo gun. As you can see that we use the liquid nitrogen to aim at the molluscum lesion. You can see that it freezes the lesion and it can thaw. Okay, so it's a bit stinging to patients sometimes, but before that you can reduce the pain by applying this local anesthetic agent to do that. So a lot of time this kind of treatment once might not be enough. You might need to actually do a few times. All right. Okay, let's quickly move on to case number 2. So this 2-year-old boy came to me with a sudden eruption of these multiple very painful skin lesions for 2 days of duration. He also has a fever. So what is the most likely diagnosis here? And you can see here, there is a multiple blisters around the mouth, and also some of the area you can see has already have this little hole in it. Looks like punch out. You use the punch to punch in. So this is the classical pictures of herpes simplex infection. It because involve the lips, we call herpes labialis. So how do they usually present? So they always present with cluster of very similar looking blister with punch-out appearance. This is a classical description of it. It's caused by herpes simplex virus type 1. And the mode of transmission primarily is by contact with infected saliva. That's why I always ask parents, try not to allow others to kiss your kids on the lips directly, because you don't know whether that person actually is a carrier of this herpes infection or not. And how do we treat them? So if it's like, multiple, causing a lot of problems, you can actually start oral antiviral, which is acyclovir. It should be initiated as soon as possible, ideally within 72 hours from onset. Sometimes this disease can be so painful and severe and the child cannot take orally well. You might want to consider starting the IV acyclovir form, and you need to be admitted and hospitalized. So next, case number 3. This is an 11-year-old boy presented with fever and widespread itchy rash for 3 days. As you can see here, the rashes is like more focused over the face and also the trunk. They are different from the previous one because this has a different level. Yeah, so some already crusted, some already dry up, but new ones of the blister just came in. So what is the most likely diagnosis? The diagnosis is straightforward. It's actually chickenpox, or also known as varicella zoster infection. How do they present? They actually present with this lesion at a blister progress to enlarge with the heel central crusting. So lesions are usually at the various stages of the healing stage. So they will present like first day maybe like 5 lesions, second day maybe 20, third day maybe 40. So by the time day 4 there are new ones that come up, the first day lesions already dry up. Okay, so it has a very important thing to remember is that it has an incubation period after 21 days. So meaning like you have the infection now, it could have been exposed like 3 weeks ago. Okay, so the classical description of this primary lesion is like blisters on the red background, known as dewdrop on the rose petal. In the world of dermatology, we always need a little bit of the imagination to actually remember things. Dewdrop on the rose petal is a classical description of chickenpox. So this, I just want to show you that the important way to know that this is like more suggestive for chickenpox because it's a distribution of the skin problem. Lesions is mainly centropedal, which means that it's concentrated on the trunk and face and less so over the acro or the arms and the legs. We move on to the next line for the treatment. So in children, so we don't really need any like specific therapy if you are not immunocompromised. Okay. So however, if you want to shorten the duration of the symptoms, right? You want to make it heal faster. So you actually can give oral antiviral, which is oral acyclovir. Ideally should be given as early as within 72 hours from the onset of the symptoms. And all the children must be excluded from their school or daycare and childcare until all lesions are crusted over, meaning like all lesions are dry up, there's no new blister that coming. Okay, and if the patient actually have a history of cancer, or those who are receiving chemotherapy or high dose of steroids, and also those who have a known history of immunodeficiency, you might want to consider admitting them and giving IV acyclovir instead. Because once this group of immunocompromised patients get chickenpox, they actually can have very serious complications. So I always get asked about this question. After my child being like exposed to chickenpox, can I still give the vaccination? The answer is yes. So once you know that the child actually being exposed already, try to give the vaccine as soon as possible. Ideally, is within 3 to 5 days after exposure. Okay, this may even prevent chickenpox from happening, or even that the child eventually develop signs of chickenpox, it may actually be less severe, right? It's really thoroughly worth it. Okay, what patients will ask, even after more than 5 days, can vaccine should be given? Yes, actually, I still ask them to get the chickenpox vaccine because this might provide protection against this chickenpox if it's exposed again in the future. Let's move on to case number 4. So this is a very different kind of appearance. This is a 7-year-old girl presented with this multiple, very scaly skin lesion on the fingers for 1 year. Mother is very frustrated because lesions has grown in size and also increased in number. And this child actually complained that the friend doesn't want to play with her because of this skin lesion. And you can see here, there's already whitish, a bit scaly, right? It's very rough, the skin. So what do you think is the most likely diagnosis here? The most likely diagnosis is viral warts. So in Malay, we call this actually ketil or ketuat. Okay, right. So in medical terms, this is also known as Verruca vulgaris. Okay, it's caused by a non-malignant strains of human papilloma virus, including 1, 2, 3, 4, and 57. So it also can be transmitted via direct skin-to-skin contact and also auto-inoculation. So the treatment is pretty similar to molluscum contagiosum. You can also wait and see because this is a virus skin infection. Sometimes it takes a while for our immune system to attack it and then tackle it. However, if it's like more than 1 year, my take is, or actually increasing in number, my take is just to treat it either physically using physical destruction, using cryotherapy, laser, surgery, or even use the medical therapy. And we actually need to tell the parents that it might take longer period of time to actually see the results or the effect of this treatment. Right, so those are the very common viral skin problems in children. Let's move on to see the common bacterial skin infections. So case number 1 for bacterial skin infection. This boy, 8-year-old boy, came to see me with these very painful lesions on his left foot near the third toe, as you can see there, right? Previously, a few days ago, he actually stepped on a nail, right? You can see a wound there on the, medial aspect of the second toe on the left foot. So you can see but he's complaining about the pain over the third toe, and you can see there's a collection of this yellowish pus there. And the surrounding skin is also very red and tender. Okay, so what do you think is the most likely diagnosis here? Okay, the diagnosis is paronychia. So what is paronychia? So this is inflammation of the skin around a finger, also a toenail, usually caused by a bacteria known as Staphylococcus aureus. This is also a common skin microorganism on our skin. So who are at risk of getting paronychia? So for those who always have a habit of biting nail, those nail biter tend to actually cause like a injury to the skin around the nail, are also at risk of getting paronychia. And those infants that suck their fingers and thumbs also at risk. And those always do a lot of manicure, pedicure also at risk of getting paronychia. And those who have ingrown toenails and also have trauma to the area near the nails, such as in this case, and also at risk, increase the risk of getting this paronychia caused by bacterial infection. So the treatments are pretty straightforward. If you have a pus collection, you might need to do a small surgery called incision and drainage. Basically, we make a nick in our office and then let go of the pus. So you feel like instant relief of the pain, because when you have this collection of the pus, the patient always complains of this throbbing pain. Okay, and with the course of these oral antibiotics, unless you have fever, high fever, then we might need to give you like IV antibiotics. You can also advise the parents to use warm soap with the water or antiseptic solutions with the antibiotics. Quickly move on to case number 2. So this is a 1-year-old boy presented with this multiple crusted lesion on the scalp, which quickly spread to the lower limbs in the span of 1 week. Mother said they were actually very large blister before rupturing. And you can see here, so there is multiple lesion, and you can see this yellowish crust. So what is this crust? It's actually dry up like this serous discharge from the wound. Okay, so we call it, this is a very similar to this honey color. So we call it honey color crust. So what do you think is the most likely diagnosis here? This is actually impetigo. This is a classical picture of impetigo. So this is a type of bacterial skin infection caused by group S streptococcus, or actually Staphylococcus aureus bacteria. So it can be transmitted via direct contact. There are 2 types. One is the bullous form and non-bullous. Bullous means that you can see in the picture here, it actually has this very flaccid, large superficial blister, which actually rupture, leave with this raw area multiple. And then the non-bullous one, you see all this honey crusted area. So usually the skin neck area is the common area that you get this bullous impetigo and also impetigo. So the treatment, why we need to differentiate is because of the treatment. So non-bullous type, we can actually, if you localize, you can just use the topical antibiotics. If it's like lesions is more widespread and also there's some systemic involvement, for instance, the child complain of fever and all, then you might need to go for systemic antibiotic. For the bullous type, you need to actually use systemic antibiotic because it can spread like wildfire. Okay. Those are the common bacterial skin infection. Let's move on quickly to the common fungal infections. So this is a 10-year-old boy presented with this patchy hair loss over the scalp for 1 month of duration with no itchiness, no pain. And you can see that at the center, or almost at the top of the scalp, there you can see this large area of this hair loss. And also there's very multiple small one surrounding it. Okay, so what do you think is the most likely diagnosis here? So this is tinea capitis. So what is tinea capitis? So tinea capitis is a form of fungal infection over the scalp. involving both the skin as well as the hair follicles. That is a very deep kind of like fungal infection. It's caused by this type of fungal called dermatophytes. The example of dermatophytes include Trichophyton tonsurans and Microsporum canis. Microsporum canis is the commonest one found in Malaysia, and this is actually very commonly found on cats. Okay, so when you have a patient like this presented to you, I always need to ask a background history. Do you have a cat at home? Do you play with a stray cat? Do you have a history of playing with stray cats before? Yeah, so that is very important. So how do we confirm the diagnosis? We can actually do hair for fungal culture. You can actually pluck the hair and send for fungal culture. We always do it in our office, and also we can do skin scraping and in this sense for the fungal culture. In our clinic, I always do this wood slab examination as well. So another thing is like this is a very, I want to highlight this case to you all because this is a very severe form of tinea capitis known as carrion. This is an inflammatory type of tinea capitis and is characterized by this very huge swelling with hair loss on the scalp, which could be mistaken as bacterial scalp abscesses. I have a surgeon who actually referred me a case like this after cutting open this lesion after operation. So when he thought that there will be pus oozing out, but actually when he cut open, there's none. Right? So he asked me what happened. I told him that actually he shouldn't have gone for this surgery because it can be treated using oral antifungal. So the problem with this Karen is because if you don't treat it aggressively and then treat it properly, it can cause permanent hair loss and also scarring on the scalp. So it's very important. If you're not very sure, should refer to pediatric dermatology fast. So this is what we talk about wood slam and also KOH examination, how we actually confirm the presence of fungus. So the first on the left is like the one with the red circle is like we managed to detect this Microsporum canis from the skin scraping. After we scrape the skin, we put on this KOH, this is potassium hydroxide. We actually dissolve the skin cell and we look under the microscope that we can actually detect this fungus. And the next picture show you that when you look at the scalp of the child, you don't really see much of a thing, right? But when you actually shine with these, blue lights from the wood slam, you can see the fluorescence of this fungal under these lights. This is also helpful in diagnosing this tinea capitis. Okay, next case number 2. So we see it quite often also. So this 2-year-old girl presented with this multiple nail discoloration with thickening for 3 weeks of duration. Mother said it started from 1 and then it actually moved to the 2nd, 3rd, 4th and all. And you can see that there's yellow discoloration, also have this brownish and blackish discoloration. Very thick nail but very brittle. And some of the nail actually, especially the little finger that already separated from the nail bed. Can you see? Okay. So what do you think is the most likely diagnosis here? So this is a nail fungal infection known as onychomycosis. Okay, how do they present? So the nails will start off like discoloration. That is the commonest presentation, and they become very brittle. Some of the patient might complain that there's underneath the nails there's a bit of mushy things that coming out, right? And sometimes you have this like redness around the nails as well. Okay, so usually it's caused by dermatophytes, this type of fungus, and you can also clip the nail. Clip the distal of the nail and send for fungal culture. So we can do it. We can do it in our office and also our clinic as well. So how do we treat this kind of fungal infection? Same as the tinea capitis, we cannot use cream because it's too deep. Right? So we have to use oral antifungal or call it systemic antifungal for a prolonged period of time in order to treat this. Otherwise, you can actually use this cream to apply. It is not going to work. It's going to cause very long. So it can cause more complications. So if you want to treat properly with the oral antifungal. Okay. Let's move on to case number 3, or the fungal infections. So we see it very often in a very small baby. If this is a 1-month-old baby, came with the rashes at the diaper areas, including the inguinal folds, including the these groin folds. And you can see a lot of these small little dots there. It's like we call it satellite lesion. What do you think is the most likely diagnosis here? The most likely diagnosis here is actually candidiasis. So what is candidiasis? Candidiasis is a type of skin fungal infection caused by a yeast called Candida albicans. Okay, so the treatment is very simple because it's a very superficial fungal infection, not like the hair and also like the nail. So you can use a antifungal cream, okay, 2 times a day, so a period of like one to 2 weeks. And the tips you want to give to parents is like to keep the baby skin as clean and dry as possible, try to change the diapers as often, and allow diaper free times a few hours a day will be good. So next, move on to case number 4. This 6-year-old boy presented with these very red and itchy lesions for 2 weeks of duration. As you can see here, it become more itchy when actually it sweats. This lesion actually located on the lateral border of the tummy. Okay, and you can look at this picture. You can see that this reminds me of very nice, well-defined red coloring. Correct or not? And then it's in the middle. Is also actually is very clear as compared to the border, right? So what do you think is the most likely diagnosis here? Okay, so this is a ringworm infection. Okay, so it's because it's located on the body, we call it tinea corporis. If it's located on the hand, it's called tinea magnum, right? So ringworm infection is also a very superficial fungal infection of the body, right? It has this classical ring-like appearance with central clearing, and it's also caused by dermatophytes, and usually it's spread by shedding of fungal spore from infected skin. So when you have somebody who had this, skin lesion, you try to avoid sharing personal belongings and have avoid direct contact with the skin, with this infected skin. How do we treat them? So this is a superficial fungal infection, so we can use topical, means like antifungal cream. Okay, so if it's like very widespread, you might need to actually use a systemic or oral antifungal. So that one tips when you actually want to teach the parents or caretaker to apply this antifungal cream is not to apply only at the ring. Okay, so you actually have to apply about 2 cm away from the border of the lesion, because by the time you're looking at it, the fungus, the dermatophytes that's causing this has already moved out, already migrate out. Okay, so you want to tackle that. You want to actually apply the skin that actually at least 2 centimeter away to the bigger ring. Okay, so that actually is more effective. So I always give these following tips to prevent ringworm infection in children. So we want to ask them to keep the skin as clean as possible and dry thoroughly the skin. Try to wear loose fitting light clothing, especially in Malaysia, very warm and humid country. So try not to wear like very tight and the material of the clothing shouldn't be like nylons. Yeah. And you want to avoid close contact with infected individuals, and we try to avoid ask patients to avoid sharing personal belongings. And very, very important, when the child come in with another siblings, I usually will examine the siblings and also examine their pets if possible, because I want to look for a source of the fungal infection. A lot of time you'll find that actually they are all affected, right? So you have a cat or have a dog or pet at home, try to actually bring it to the vet to try to get like treatment, antifungal treatment. Otherwise, you get infected again and again. It's going to be a vicious cycle of that. All right. Lastly, let's move on to parasitic skin infections. So what are these? So I have a patient who came in and see me, very small child, okay? 8 months old boy, as you can see here, very itchy skin lesions all over the body, including the hands, right? Especially the lesions are more in between the fingers, the toes, the underarms, the armpits, and also at the groin area. So this has going on for like 3 weeks of duration. And the mother also actually complained of similar skin complaint, although it's like less severe, but mother also has like skin itchiness as well. And she complained that this itch is worse at night. So what do you think is the most likely diagnosis here? So the answer is scabies infestation. This is not infection, but infestation, because this is a parasitic skin infection. So how do they present? So this parasitic skin infection, scabies, in Malay is all called kudis buta. Okay, it's caused by a mite known as Sarcoptes scabiei var hominis. This is a picture of the adult mites that you can see, and it's transmitted through prolonged skin-to-skin contact in between this infected individual and also by sharing their clothing. So the thing is that a doctor actually asked me before, can I get this scabies from my patient after like maybe 5 minutes of like consultation in the room without like prolonged skin-to-skin contact? The answer is no. Don't worry so much. Most of the time, you need to have this, prolonged skin-to-skin contact with the infected individual. Like for instance, caretaker, the nanny, or the parents who's actually the primary caretaker, then you actually at risk of getting it. So how do they present is that they will have these multiple red bumps with burrows, distributed over the hands and feet, including the interdigital web spaces and also the armpits and also the groins. So I'm showing you a picture here, the burrows. What is this? It's like these adult mites, they crawl underneath the skin and create all this tunnel, right? So then that's why actually is a very useful clue when you look at the skin and you find these burrows. This means that actually you have a scabies infestation. How do we treat? So in a small child like this, 8 months old, we have like multiple choices of treatment. So the most useful one and also most effective one is actually an anti-scabitic cream known as permethrin. Okay, so you use 5%. You can use on day one. After 7 days, you actually use another time. So why is it so? Because this permethrin actually can kill the adult mites, but cannot kill the unhatched eggs. So you actually give the treatment on day one, and day 7 you treat again because you want to kill off all these like scabies that actually hatch in between. All right, so does it make sense? So we can also use sulfur 6% in petrolatum jelly and also clotimeton 10% cream. In older children, more than 2 years old, you can consider using a benzoyl benzoate cream. This at 12.5%. If you're more than 12 years old, you can use 25%. However, this benzoyl benzoate cream actually is associated with higher side effects such as skin dryness and also itchiness and skin irritation. So this, I always want to like give practical advice to parents when the child has scabies, because a lot of time patients come back with like recurrent symptoms. They always say, why is it not going away? This because we didn't give this advice to the patients or parents when we give this treatment. So very important to remember that when you apply the cream, you apply to the entire skin surface from jawline downwards, including all the body folds, the groins, the navel, and also external genitalia. And if possible, try to do under the skin under the nails as well. This is because like these mites, they like to actually hide at these warm and folded areas. And don't be surprised that actually in younger children, they have lesions over the face and head as well. This is also a bit unique for children as compared to adult. In adult patients, when you have scabies, you don't really have this lesion on the face. The face usually is spared. But in children, it's usually not usually, it can actually affect the face. So the second very important tips is actually to make sure that all the contaminated clothes and bedding be washed at high temperature if possible, or actually to be more practical, you actually boil them over the big pot. Okay, and also if let's say really cannot, like for instance your mattress and all, you cannot boil them, you actually can keep them wrapped up in a plastic bag for at least 72 hours. Actually, I'll ask them to do it for 1 week. Okay, and the third important advice that you need to give it to the family or caretaker is this one. I think this is the most important take-home message. When a child in a family has been diagnosed to have scabies infestation, you have to treat the whole family, regardless whether they actually have symptoms or no symptoms, right? Whether you have itchiness or no itchiness, it have to be treated. It is because not every individual will demonstrate the skin, the same symptoms. Even though you're infected, you could be the carrier, but you don't have that itchiness, right? So if you just treat that patient only, you just treat that child only, I'm very sure, I guarantee you will come back in 1 week's time telling me that, no, doctor, the treatment has failed. This is not because of the treatment has failed, because the medicine is not good. It's because we didn't actually do it correctly. So regardless the parents or actually the family member has symptom or no symptom, you need to treat. The second important point is you need to treat at the same time. meaning like you cannot treat the child like 3 days before and then 5 days later, then you actually the child family come back from like other place, then you only treat the family 3 days or 5 days later. It's not going to work because like the remember the adult mice might lay eggs, right? And then actually when you didn't treat at that time when they hatch and then they didn't get treated, then actually will sort of like the cycles will perpetuate and cause like chronic infection. So please remember this, yeah. Okay, so this will be the last case of parasitic infection. So this is a 16-year-old boy who came and saw me and complained of this very weird looking itchy skin lesion for 2 weeks. It's so itchy that he cannot sleep at night. And from the history, he was working in a construction site during his school holiday to earn some pocket money. And he also noticed that there were a few stray cats around the site as well. Okay, and you can see here this very weird, like linear, like tortuous kind of like like thread-like things under the skin. Okay, so what do you think is happening here? Yeah, so this is what we call cutaneous larva migrants. Okay, so cutaneous larva migrants is actually is a condition characterized by this hookworm infestation. Okay, so this parasitic skin infection that will infest the cats and dogs. So what happens is like when they grow up, they become larvae, it penetrates the skin and go through under the skin and really crawl under the skin, causes these allergic reactions. So in the next slide, we'll show you the how actually this happen, the cycle. Yes. So we start off from the center first. Okay. You look at these cats and also the dogs. So these cats and dogs are actually affected by these adults hookworm. Okay, they are already infested by these adult hookworms. So what happened that in the intestine they already lay eggs. So what happened is that when these cats and the dogs poop, right, then these eggs will come out in the feces of these animals in a very like suitable and appropriate environment. It actually hatched to become a small worms like larvae, and actually will grow bigger to actually a bigger larva, which actually can be infectious. So when it reach a suitable host, like for instance an animal, they actually infect the animals again, go into the skin of the animal. And also, but in human being, when for instance like you're walking barefooted, right, on the sandy beach where there is lava, right, it can actually take this opportunity to go into the skin, underneath the skin, and really crawl under your skin. Okay, so this is what we call cutaneous larva migrants, and this will cause like an intense itch, and it's actually an allergic reaction to this kind of larva, this kind of hookworm infestation. How do we treat them? Most of the time, surprisingly, is actually self-limiting because we humans are sort of like not meant to be the host of this kind of hookworm. It's like a dead-end host, so that eventually, however far they want to travel, they want to migrate, the hookworm larvae will eventually die in the skin. Okay, it can actually result. However, it might cause this intense itch and all. So usually, I will actually treat with this anti-helminthics or oral albendazole for 3 days. All right, so I think that's all for all the common skin infections in children. So in summary, these are the take-home message. I want to highlight to you that skin infections are very, very common in children, and they are not just skin deep. It can cause a lot of like stress to the child and also to the parents as well. And also, I will urge you to have an early consultation to your skin doctor. This is very important because it can prevent the spreading of the skin infection to other children or other siblings, and also to prevent other more severe complications like cellulitis and all these things, which can result in hospitalization, which is unwanted. Okay, with that, I would like to thank you for all your attention. So I'm happy to actually answer any of the questions.
Hi, Doctor. So thank you so much, Doctor, for your expertise and valuable insights. Now we'll move on to the Q&A session. And thank you,
Okay.
everybody, for sharing your questions. So the first question I will put up on the screen: why nowadays children will have eczema? Is it due to food or environment? Maybe you can.
Yeah, thank you, Sui, for such the question. So it's $1 million question. So a lot of people are more aware nowadays that eczema is more prevalent. Actually, it's not like that. I think it's more of like awareness. The public awareness of this eczema has increased lah. Right, so eczema, we also known as atopic dermatitis, is a very chronic, skin conditions. It's very complex. As a result of this interaction between immune system, genetics, and also environment. You'll be surprised to find out actually studies have shown that about 10% of this, is due to, has related to food. So I just want to highlight that when you have eczema, you are at increased risk of getting food allergy, right? But they are not the cause of each other. So there are two different entities. So you have food allergy. It doesn't mean that you definitely will have eczema. All right.
Okay.
Hope that answered your question.
Actually, Sugi has two more questions, if you don't
No
mind.
problem. Yeah, thank you so much for participating.
Okay, here you go. Would you like to read it? Would you like me to read it,
Oh
doctor?
yes, yeah, I read it. Yeah, no problem. If eczema issue, is it will last forever or is no treatment beside taking steroids or apply steroid creams forever? If you don't want to take steroid, is there any other options or opinions to treat? Thank you so much, Suki. Yeah. So first, let's tackle the first part of the questions here. So will eczema last forever? All right. So a lot of time, last time we used to say that, we have eczema, no worry because at last you will outgrow it. But from all the latest study, we know that this is not true. So there will be like 30% of this group of children who have eczema will still bring these symptoms when they are into adulthood. Okay, so you don't actually, wait. You have to actually start treatment to reduce the symptoms and to help to increase or to improve the quality of life for children who have eczema. Don't wait until they are older because they will be too late. All the complications will come in. Okay, so yes, at the moment there's no cure for eczema, but there's a lot of way to control it, so that the quality of life is just as the same as his peers or her peers. Okay, so steroids and apply steroid cream forever is not exactly like I want you to apply it forever. So I need to introduce the concept of eczema is an ongoing disease, right? You will have this disease, like you will have for years, right? So when a disease is ongoing, meaning like you need the treatment to be going to go on, not because you're dependent on it. Okay, you have a condition that is actually happening, is continuously happening. So which means that you need the treatment to go on. Okay, so that is a very important concept. But it's not that you need to use a steroid cream forever. Okay, if you don't want to take steroids, yes, there are so many other options nowadays. We're talking about creams. We also have other non-steroidal anti-inflammatory creams nowadays available. But you need to actually consult a pediatric dermatologist to start this treatment. Okay, and also there are also, other than cream, you can also give like injections or biologics or any other oral medication that can be used to treat eczema. But usually this kind of treatment we will reserve for those patients who actually have moderate to severe kind of eczema that is not optimized using creams.
I
Hope that answered the
see.
question.
Okay, thank you, doctor. Actually, based on your answer, I was also just wondering. So, would steroids be a good long-term solution, or
Mm.
would you advise someone to have different ways of treating their eczema?
Yeah, so very good question. So a lot of people, they come in to see me, they say, I don't want steroids, but they don't know actually what steroids can bring, what kind of side effects are associated with steroids. So I will always say like things are always have two coins, and the coins get two sides. You always need to look at what these steroids can help and what are the bad things about this. So I always say like this thing, steroid, if you use it correctly, it will really help and really can save life. Right? But it's just same thing. I give a very how to say a common example that I give my patients. So when you drink water, you drink 1 liter a day is good for health, or 2 liter is good for health. But if I ask you to drink like 10 liter, what will happen? You have water toxicity, right? It can cause death. Okay,
Yes,
so even like a so benign water like this, if you don't use it correctly, you don't drink it correctly, so it can also bring very severe complications. Same thing with steroids also. If you use according to instructions, and with monitoring, right? So it will actually help to control eczema tremendously. Okay,
Okay.
so we have different like concentration and potency and the strength of the steroids, and not everybody actually have to use very strong one. It depends on the severity of the eczema of the skin.
Okay.
Yeah.
Thank you so much, doctor. Okay, so for our next question from Ms. Laila Ila, she said she actually asked if eczema has any relation to vaccination.
Yeah, Karin, we have all the eczema related questions, not the skin
Yes.
infection.
Yes,
Anyway, I
continue.
thank you, Laila, for your questions, because a lot of parents they want to know about this. Is vaccine related to eczema. So let me tell this: vaccine is not the cause of eczema. This is very important. However, when you have a vaccine, whatever vaccine, it doesn't mean that it's COVID vaccine. You can have like influenza vaccine, you can have like normal mandatory pneumonia, no, pneumococcus vaccine and all this. So after that, actually, this vaccine is a stress to the body. Right? Sometimes it can actually, alter a little bit of immune response. You can have a bit of fever. You might have a little bit of runny nose and all these things. This is a stress to the body. And if you have eczema, it can cause a flare of the eczema because it's a stress to the body. Right? It is not the cause of the eczema. Not because you give the vaccine, then you develop eczema. It's not like that.
Mm.
Yeah.
It's the
As I
immune
mentioned,
system, right?
it's a very complex interaction between your immune system, environment, and also genetics. Yeah.
Okay, thank you so much, Doctor. So now we will be talking about for another one from Sugi.
Hey.
Thank you so much, Sugi. So if children already have chickenpox when they're younger, is it necessary to recommend for them to take the chickenpox vaccine again, which I know you've addressed earlier in
Right.
your presentation, but I'll
Yeah.
leave it to you.
Yes. So, okay, when a child actually has a chicken pox, so you assume that you already have the immunity towards it. But the thing is that first of all, are we very sure that there's a chicken pox? Number one. So if you are, yeah, not everything as you see, all the blister is actually chicken pox, right? So there's another point I want to bring out is like not everybody actually will develop this immunity towards chicken pox or anything after you have the infection. So even though you have a chicken pox when you're small, if you are not 100% sure that it's chicken pox, you can still, I would actually recommend to do vaccine, chickenpox vaccine, because once you get the chickenpox vaccine, you will not get herpes zoster. Herpes zoster is like Malay we call it gayap.
Oh.
That's a prevention of that. Yeah, gayap is actually, or herpes zoster is actually from the same chickenpox virus that actually stay dormant, right? Stay quiet in the nerves. So when you have your immune system down a bit, so this virus will come out and cause problems.
Hmm.
Okay, so there's a lot
Okay.
of benefits.
Thank you so much, Doctor. Actually, we have some people that have written in
Yeah, sure.
some questions. So, somebody asked, living in a tropical country, are there specific sunscreens or sunblocks that are recommended for children? And what should parents look for on the labels?
Okay, yes, this is a very valid question concern, because we are living in Malaysia. We are in a tropical country. We actually get sunlight throughout the year, so it's very important to protect our skin from the UV damage, because this is the cause of aging, and also like wrinkles and also moles, as well as skin cancer. The most important thing, so sunscreen is very important. When it comes to skin protection. So I would recommend children to get mineral base. Okay, mineral physical base. So how do we know it's a minerals or non or chemical? There are two types, mineral and chemicals. Is we actually look at the content. If it's label like, first they will write down their mineral sunscreen. Number two, you will look at that. You say titan is contain titanium oxide, right? Zinc oxide, all these minerals. So these are generally actually mineral sunscreen that can
So
help.
it's very safe.
So yes, yeah. So other things you need to look out for in the sunscreen bottle is, if possible, try to look for coverage, broad spectrum coverage, means that it cover UVA and UVB both. And also look at the SPF. So this is the factor that will induce the redness by the sun. So I would recommend at least 35 to 50. right? So me myself, I actually in Malaysia I use 50. So there's no point of getting something that is over 50. No point giving 100 because studies have shown that there's no added benefits if you actually use more than 50. And there's no like extra, benefits of that lah. The only problem is that you use SPF 100, you feel that the sunscreen is very pasty. Okay, it's very difficult to actually apply. So the child or children might not like to actually apply those very thick layer of creams on the skin, especially in tropical countries like Malaysia. And it can also trap sweat under the skin, and it causes
Wow,
very uncomfortable and skin redness as well. Yeah.
I see. Okay, yeah, that's a good point. Thank you so much, Doctor. We just have two more questions. Just I know your time is very
No
short.
problem. No
So
issues. Yeah.
okay, so someone asked, are there any certifications, any certs that or labels that parents should look out for where on packaging of any products that they're buying for their children's skin?
Oh, you're talking about moisturizer? Yeah.
Um,
Skin
most,
product
yeah,
in
specifically
general.
for children,
Yeah,
yeah.
skin product general. So okay, I always like hear people, I mean parents asking me, should I buy organic products? So organics, anything that comes in the bottle on the it can last like 3 years in the shelf life, it can't be that organic. Because you need to actually add preservative everything to actually make it last that long. I think the organic thing that really is really organic is from the backyard. You get something from a backyard, you already make into a paste, and that's it, right?
Yeah.
So yeah, right. So I don't believe in like you're only looking at this like organic things that labeling, yeah, that actually cost it. So when it comes to skin product, so how do I actually advise parents to choose the best skin products, especially we're talking about like a moisturizer? Okay, so moisturizer, I will always say, is something that you will use for long term, and it does not actually cause allergic reaction to the skin of your child. So that is the one that you want to pick. So no fragrance, right? The nicer the smell of this, actually the more drying it is to the skin. It can increase the risk of the irritant contact dermatitis. And I don't want any colors. So that's why actually you can see in the market all these like dermatological brands of this skincare. They are usually just white color, no smell. There is a reason behind it.
Water
Yeah,
based,
because
right?
correct. So they don't want any added like risk of causing irritation and all this. Okay. Another point is that it has to be aesthetically or cosmetically acceptable. So even though I know that ointment is actually nice, but certain children they don't like the greasy feeling of this, right? There's no point actually you apply something that is greasy and then the child doesn't like to use. And sometimes when the child sweat and you use this ointment, and it can trap the sweat underneath and cause more problems. Okay, so although we know that ointment is generally like less risk of stinging, causing less pain, it lasts longer, but still you have to ask the child, do you like this? Do you want to use it every day? Okay. And the very last important point when you actually come to skincare product, when what how to choose is like it has to be affordable for long-term use, because skin care you need to use it for maintenance for a long period of time. You need to use it on wide body surface area. For instance, like eczema patient, you need to use moisturizer, right? The moisturizer need to be used every day with or without flare. There's no point of you buying something that is very expensive and you have to skim on the use, okay, and defeat the purpose of using this moisturizer. You want to use something that actually that it work for the child likes to use, and also you can afford it for a long period of time. Okay, so the cheap product doesn't mean that it's not good, right? So there are so many like affordable products in the market that also works very well. Okay, of course, if you want to have something that extra benefits or something, you feel that it's better, your child likes better, then you can also choose the enhanced one. But the important point is choose something that the child wants to use for long term and you can afford it one and works for your child. Yeah.
Great advice. Great advice. Thank you so much for answering all the questions that
Yeah.
our
Thank you,
viewers
Karin.
have given us. And also, thank you so much, Doctor, for your time and your expertise. We
Yeah.
truly,
Thank
truly
you,
appreciate
Karin,
it.
for
You
inviting
know,
me. Yes.
there's not many of you out there. So yes,
Yeah. Correct. Yeah. Just
yeah.
like just some take home message. So we, even though we are rare, we are not like in abundance in the market. But the thing is that if we are here. We are here to actually help your child, help you to take care of the skin of the patients, the babies, or even your children. A lot of the time, I find that the parents are very guilty because they feel that they are the one who passed on the disease to the child, and then didn't like spend enough time in taking care of the child's skin. That's not true. Yeah, that's not true. So a lot of time you know that you have worked very hard, but the thing is like you're not getting you're getting nowhere. Yeah, you feel like very like disappointed why actually the skin condition is not getting better. Let us help you. All right, if you have problems, don't keep on like suffer in silence. We are here to help you anytime. Just come to us, we'll give you the help to solve the problem together, right? Okay, we are always here to help you to manage the skin problem in your children.
That
Okay,
is a very
thank you very
warm
much.
message and very reassuring. Very reassuring. So,
Thank you.
I would just like to thank you again for the insightful discussion. And on behalf of Global Health Asia Pacific, I would like to thank you for your time again. And also, everybody here, thank you for joining. But to book an appointment with Dr. Mimi Wong, visit www.gleneagleskualalumpur.com.my. And before we go, I think anyone would like to ask any more questions? I think there's no one.
Last burning question.
We'll give you some time, but also we just while anybody's asking any more questions, we just want to say thank you so much for all our attendees.
Yeah,
And
thank
in
you.
the
Yeah,
comments later, you can see that there are a lot of people thanking you in the comments for your
oh, thank
time.
you.
Yeah,
I feel so good, so happy. Yeah, thank you everyone for joining us this afternoon. Hope to see you again in the next webinars or in the near future. Yeah, be
yes,
happy to
yes,
share whatever topics. You can also share your thoughts. What are the topics that you want to know, and actually we can discuss further. Yeah, I'm really happy to actually share, the management plan, or actually to answer any of your questions and your doubts that you have. Okay,
yes.
so skin conditions in children is just not skin deep. It actually have a great impact to the family, the quality of life of both the children as well as the caretaker. Just remember that.
Okay. Okay, so everyone's just saying thank you. I think you've answered
Right.
all the questions they need.
Okay,
Okay,
great.
so thank you everyone again, and look out for our future webinars. Look up Dr. Mimi on gleneagles.com.my, and thank you so much. That's the end, guys. Bye. Thank you.
Okay, thank you so much, thank Corinne. See you again. Bye.